On our recent Public Health Roundtable live stream, I decided to change things up a little bit. Instead of our traditional roundtable discussion, I took the virtual stage alone to address the initial state of shock and overwhelm that we were dealing with, all of us here, in the first days of transition to the new presidential administration in the U.S. Since that recording, so much has unfolded, but I do think that my message is still relevant and helpful to share on this episode. You're listening to the PHEC podcast, episode 394. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. In this episode, we are sharing a conversation from a recent Public Health Roundtable Live, which typically occurs on LinkedIn during the first Wednesday of each month. Every month during the Public Health Roundtable discussions, we cover a variety of health topics, bringing together a panel of public health professionals to share their perspectives. We encourage audience members to participate in the comments to continue the conversation beyond what the panelists share. On our recent Public Health Roundtable live stream, I decided to change things up a little bit. Instead of our traditional roundtable discussion, I took the virtual stage alone to address the initial state of shock and overwhelm that we were all dealing with in the first days of transition of this new presidential administration here in the U.S. Since that recording, so much has happened and unfolded, but I think my message is still relevant and helpful to share on this episode. Let's connect that message right now. Hello, everyone. This is a very different setup. We normally have our Public Health Roundtable live discussion the first Wednesday of every month, and I'm usually joined by a panel of public health professionals and experts. Today is a little different. I decided today it's just going to be you and me. This is still the roundtable discussion time, but I'm actually taking advantage of this opportunity to share a bit of maybe encouragement. I'm hoping it will be received as encouragement to all of you. And this is very troubling, stressful, frustrating, insert whatever, descriptive you have here, time that we're in as public health professionals, especially here in the United States. So I just want to talk about leading through change, and I will throw this banner across so that if you are joining at any given time in this live stream, if you're watching the replay, I want you to know what we're talking about. It really is me sharing some thoughts that I have with you. I'm going to be a little vulnerable and transparent, and hopefully this is received very well. Introductions, in case you're wondering who this lady is babbling on. My name is Dr. Charlotte Huntley, and my name is on the screen. If you happen to be watching the video, please look me up on LinkedIn and connect with me if we're not already connected. I am a public health entrepreneur. I am the CEO of DrCHHuntley LLC, and we're an epidemiology consulting firm, and we essentially provide support from analytics to reports, anything revolving the data and analytics and communicating that to the communities that we serve. We are proud to support organizations that serve BIPOC, so Black, Indigenous, people of color communities. We do support a lot of tribal organizations, and we are always honored and humbled whenever we're invited to serve, and we're very proud to be a part of helping to communicate that health information. I say all of that to say also I wear many hats, but that is primarily where we lead. I provide support to other public health consultants and entrepreneurs. I'm the host of the Public Health Epidemiology Conversations podcast. Many of you may be familiar, but if you're not, make sure that you make note of that and look it up. We produce new episodes every single Tuesday. and we've been doing this since 2017. So I bring a very interdisciplinary kind of skill sets to public health. I have over 25 years of experience in both healthcare and public health, and a lot of insights come along with that perspective. A lot of you are multidisciplinary professionals, and you understand the unique kind of positioning that you're in with that view. That's my introduction. That's who I am. So let's kind of dive into this. So right now, things are really frustrating, right? At the time that I'm recording this, the last week was probably the hardest for us. And every single colleague that I spoke to in public health had very similar feelings of, I would say, the entire spectrum of emotions I heard from all of my colleagues as I had conversations. I experienced it myself from, data being taken down and resources that trusted resources and sites that we've gone to, like CDC, from funding being, just stopped midstream, and the impacts of, people losing their jobs. It reminds me of just a whole traumatic experience, but we have just been hit in every different direction. And there was really no amount of preparation that really had us ready for what the reality landing. So I start there just to say, I'm not exempt. I mean, I had all the feelings. I completely was at a loss for words. I remember feeling like I couldn't breathe, and I actually had to unplug and go off the grid just as a pure coping mechanism. I just couldn't take anymore. I took a full day and just had to escape from it all just to get my thoughts together and kind of recenter. And then so since I plugged back in, it was like there was more. So it felt so overwhelming. I get it. What I'm sharing, and about to kind of go into is not from a position of, oh, I just kind of dust this off and I'm okay. There's nothing about this that's okay. So that's just, right there up front as a foundation, or as a disclaimer up front, right? But now I do want to remind you of a few things. We are resilient. And I know you've heard this. And sometimes, even last week, I remember thinking, I don't want to be resilient. I'm tired. I don't want to be strong. I don't want to be all these things. And there was nothing that I could say that was encouraging to anybody, because I was like completely depleted. My resources were empty. So I had to first figure out a way to encourage myself and get myself up to then be able to lead. And that's really the foundation of what I'm going to be sharing with you and what I want to remind you of, because we all know this, but it's hard to grasp it right now. But if we as leaders, and everyone, I think of us, all of us in public health, are leading on some level, in some capacity, especially those leaders you are over a group of people, over a community, you're making decisions, you feel the weight in a very different way, really wanting you to pay attention to this, because if we do not prioritize ourselves and take care of ourselves first, then we have no service to anyone else. And that has to really sink in. And for me, this is the vulnerable part. I'm going to tell you how I felt. I felt like I couldn't afford to pause, and I couldn't afford to step away, and I couldn't afford to take some time off. And there's so much happening. I needed to try to keep up. But I also was aware that this could consume me and keep happening. Like it could swallow me up and then just keep on moving. And I serve no one in that capacity. I had to pause. Sometimes it gets to a point where you realize, okay, it's almost like a survival mechanism. I've just got to do this. But I don't want it to get to that point. I want you to remember that if you don't prioritize yourself, not just to get the edge off, but that has to become the new practice, that we're not going to win. We're not going to survive this. And we have a long road ahead. We've got several years ahead of us of leading and guiding. So if you lift your head up a little bit from what's happening right now in the immediate weeks or days ahead, and look a little bit ahead to what we need to accomplish and what's ahead of us and what we still need to do, we've got to regroup and take a more strategic approach, right? For a lot of us, if we go back to the initial kickoff of the pandemic and the height of the pandemic, we need to take the lessons learned from that experience, because we learned a lot about ourselves. We learned a lot about systems, good and bad, but how we were able to come together as an industry, as professionals, and creatively solve so many problems that we were faced with instantly. There's a lot of lessons in that we need to pull and apply now in what we're dealing with. Okay. But before we can do all of that, we have to rest a bit. So when I'm talking about rest, I'm talking about physical rest. Yes. I'm talking about emotional rest, spiritual rest, all of the mental rest. Like we need to rest. So for me, changing my environment was the biggest thing and the most impactful thing I could do. I had to get out of my regular space. So just normally, if I work from my home office, and then move down to my office downtown and work. That's a change of environment. That's enough to spark a little energy and re-energize me. When I need a break, that's why vacations are nice. Leaving, even if I just go a couple towns over or go the state over, going someplace different and changing the environment is really strong. For me, when I unplugged to go off the grid last week, I went for a drive out in the country and it's kind of funny. I live in a rural area, so everything around me is country, but I really got out in an area there where it's really kind of sketchy phone service sometimes. I like hiking to get away from things, but this time I just needed to get into a completely different space where I like that my phone didn't work because, sketchy internet service, because it really allowed me, I truly was disconnected. And then I also, during that time, I can't control all the thoughts. Like, my worries will pop into my head, but I just kind of decided to dismiss it. I didn't allow myself to go into any work-related, industry-related topics. Actually, to be even more transparent, my husband and I have this 3 to 5 year goals and these plans, and it's about this, it's a big, convoluted kind of personal goal. So I threw myself into that. We're researching and we're going through all the what ifs and trying to see what's possible. So I spent that time really immersed in that project, just the thought process, the research part of it. My brain goes there anyway, and that's a good exercise. My brain has to be busy. So I gave it something different to really get engrossed in. And that's how I was able to take that mental break. And my mind was really busy and active, but I gave it something else to get involved in and to think about. And my word for the year is expansive, really wanting to be aware and be open to all the possibilities. So that was a great exercise that aligned with my word for the year. And it allowed me to get that mental break and rest in a way that I just couldn't do in my normal environment. Another thing for me is I picked up this. So walking has always been my exercise of choice. So running is a thing that I picked up. And I say that kind of hesitantly because it's really not running. It's a very slow jog, but it's something that it's a go-to. So initially it's like, okay, I'm really frustrated or stressed. I've trained myself, okay, let me hop on this treadmill or let me get out here and go for a run. And that's a great way to get the energy out. And that works a lot for me. So I encourage you to pick up a new hobby or habit or something that can be your go-to. You can train yourself to kind of do this regularly, not always, oh, things are bad, let me go do this, but insert that in and take that break. I have a walking pad in my office now so that I can get on that. It's sometimes to think, oh, let me go outside and take a walk is really nice, but it feels like, oh, it's so distracting. I've got to do all these things and pull myself away. But if I just walk across the office and get on the walking pad, sometimes that's enough. It makes it easier for me to break up and get that little bit of a self-care moment in there for myself. I was in a meeting with one of my clients because one of the first things I did was start to reach out to my clients and just kind of talk through what's happening. And they were talking about how they were picking up knitting and needlepoint. And sometimes sitting in a Zoom call or a meeting, they'll just, she said, if I'm looking down, I'm not being disrespectful. I'm working on a needlepoint. And I found that sometimes as I'm talking through things and just doing this, it's therapeutic. And then another one of her colleagues, for her, it was knitting. So it gave me some ideas about, I have a few starter kits for crocheting. I have a sister that crochets blankets. And I thought I've always wanted to try that. So I have a starter kit that I'm looking to buy. And I'm thinking maybe I can pick that up and just crochet or do something, while I'm at my desk or to, kind of break the pattern and to pour back into myself a little bit. So I'm sharing all of this with you because these are things that as we're dealing with all this, I'm talking to my colleagues and they're leaders in these nonprofit organizations that are directly impacted by everything that's happening. These leaders are inserting some of their hobbies and things that they need to do to take care of themselves, realizing that if they're not taking care of themselves, they are of no service to any in their organization or anyone else that they serve. So I'm hoping that this is getting to you in some way that if you don't take care of you, the few of us that are standing here and deciding that we are going to do we're in it for the long haul, or maybe you don't even know what you want to do yet because you don't know how you feel. I encourage you to pause and do something for yourself. Insert self-care, whatever it means to you, however you define that. Because if you do not take care of yourselves, we cannot then brainstorm and come up with the solutions that serve the populations of people that matter most to us, that we care so much about. We cannot continue to do the good work and show up if we don't take care of ourselves. I hope that this is hitting for you. I'm going to also let you know that I did this in 2 phases. I did that one day, and then I took a longer stretch. It took a little bit of the edge off. Then I took another stretch over the weekend. I said, okay, we're going to do this activity. We're going to go out. And a lot of it was just fun stuff. You got to remember to still have insert some activity that is fun and rewarding to you. So we got out to do some things like that. And I didn't allow myself to go right into solving problems, although it was starting to feel a little bit better. I wanted to make sure I was rested emotionally, physically, mentally, like I needed a little bit more time. And by doing that, I then, once I got to, the end of the weekend, I really started to feel hopeful. Like hope was really starting to rise up. And then I got a little angry, not like in a bad way. I think sometimes it's good if you're a little angry, because, and then I started thinking, oh, wait a minute. The resilience in me started to wake up and to rise up. And I think that once you take that time and invest in yourself to take care of yourself, then you come back with a renewed sense. Because a couple of things I'm reminded of now that I couldn't think of last week was, we are very proactive. As public health professionals, we're always talking about prevention, right? We're very proactive professionally. So once you rest, you take care of yourself a little bit better, and you kind of get that balance, then that's going to start to rise up in you. And we don't need to be reactive. We can't go the next 4 years being reactive. We're going to be exhausted. We have to kind of leverage this and become a little bit more proactive. And I think that we can't get there until we rest first. So I keep, nailing it in, but I really need you to take that home. Rest, rest, rest. Pour into yourself, because we need you. And we need you to be a present to do the good work that we have been doing for all these years, and to lock arms. We're surrounded by a community of brilliant people here in public health. Think about your colleagues and friends that you can reconnect with. Lock arms with those folks, and let's support each other and be strong through this. But not necessarily to expect your colleague to pull you up, but we have to individually pour into ourselves. So then when we lock arms with each other, we're coming as our best selves. And then we can become that strong front line for the communities that we serve. We have the solutions, in our brains, in our hearts. We know what to do. We're thrown off, and this chaos is meant to throw us off, but we can't let that win. Let's pour into ourselves, rest up, and then we can show up. I have some exciting things that are on the horizon that my team and I were planning on before things got crazy. But now that all of this is shaken, we realized that months ago, the things that we were putting into place was so perfect for this season that we're in and that we're going into. And what I'm talking about is just going to be very good for a lot of you. I think you're going to be very excited about it. And I don't even want to go that far into it right here, because I want you to rest. I want you to take that on and know that this is something you've got to do. And think about how you want to do it. As a point of accountability, I'd love for you to comment on what that is that you're going to do. Share that with us. I'll even encourage you to send us a direct message. You can direct message the company page right here. You can direct message me individually and just say, hey, this is what I'm planning to do. Let me know what your thoughts are, how this hit for you, what you're doing to rest. Share that in the comments, because that may help some other people who are still struggling with what to do and how this, feeling very hopeless. I think that we've got to break through the overwhelm, and the first thing to do is to pour into ourselves. I am going to also provide this opportunity. I'm going to invite you to connect with me. So our business page here is DrCHHuntley LLC on LinkedIn. So connect and follow our business page so that you know when we have our LinkedIn live streams, our roundtable discussions, what's coming up with the podcast. But connect with me personally if we're not already connected. And if there is something that I can do, if my company can provide some support to your organization in any way, then please reach out to us. If there's a need that you have and you're not sure if we do that or not, reach out to us anyway. And if we can help you, we will help you. We are leveraging our community partners and network, and maybe we know someone who can help you if we can't. So that goes through our business page. You can message us there. You can message me directly. Send a direct message on LinkedIn if there's something that I can help you with. Or if you have a question about something, maybe I can point you in the right way, a right direction, or connect you with someone who may be able to help you. We're a very resourceful community and resilient community. And I'm not claiming to have all the answers or that I can do everything. I just want to be of service. So if I can help you, I want to be able to help you. If I can point you in the direction of someone who can, then I want to be able to do that as well. We will get through this. We will get through this. And we don't have all the answers exactly in place, but a lot of brilliant people are really working on some strong strategies. So support those big organizations or your public health organization of choice, whoever you follow and support. that is doing the good fight, support them even more in whatever way that looks like. If you can volunteer, if you can offer financial support to those organizations that are doing that good fight on the front lines for us as public health industry. But then aside from all that, you can't think about all that until you first put on your own oxygen mask and take care of yourself and breathe. Take a deep breath right now. Inhale, exhale, and breathe, and then decide what you're going to do to prioritize your own self-care and what you're going to do on an ongoing basis to not let your resources deplete. What does that look like for you? I would love to hear from all of you what you decided to do, what you're thinking about doing, what you're going to do to prioritize yourself. It's just important to do it. This is, a good time to, as you remember back in the pandemic, a lot of us started gardening and picking up all sorts of new habits and hobbies during that time, to kind of combat being on lockdown, right? Well, what can you bring into your life? What new hobby can you bring in? If it's, I brought this up when I delivered the keynote to the Black Caucus of Health Workers, their awards gala a few months ago. I shared a similar topic because it was right before the election. I was like, this, get ready and this is what you need to do. And I gave them a lot of ideas. But one of the things I talk about was historical self-care. We have been historically cared for by our ancestors, especially when I think about the Black community, and I think about my grandmother, my great grandmother, and for us, it was around, food, the good food at the table and feeding the family. And that was a source of joy. And it brings back such fond memories of my family gathering together. And that was how, we were so cared for. I wasn't always aware of the problems. I was aware of some of the problems growing up, but not always. They protected and shielded us. And there were so many happy moments, and my family was so loving. And there was so many wonderful moments. So much so that if I start baking, sometimes I get in that mood. I'm just happy and I'm baking. But sometimes if I'm missing my mother or missing a relative that's already gone, I will pour my energy into baking. Sometimes I bake their favorite foods, or it's a source of comfort and joy for me. Now, the watch out is, those things are not, usually it's cakes and pies and things that are, I shouldn't be eating, and I should eat a lot of them, but I bake and I share to kind of count. So, if you get into baking, make sure you're sharing. So I'm not trying to encourage you to bake a cake and have it sitting right there and you're eating cake every day. But those comfort foods are really rewarding for us. And sometimes that's a way that I can put my energy into an activity that makes me feel good, and then it reconnects with historically how I was cared for. So that historical self-care can be a great way of taking care of yourself. Maybe it's a tradition that your family had and you want to carry that out, and you want to do that because it reminds you of how you were cared for. It's a happy source of a memory or connection to how your folks historically cared for you that you can bring up right now. So that's just something to think about. I'm giving you all these ideas. Some of these are very personal to me, but what are your thoughts? What comes up for you, and what can you do to take care of yourself? I just really need you to take care of yourself so that we can continue to do this good work. All right, I'm going to wrap it up right there in the good sense of how we don't go too long-winded on these LinkedIn Roundtable Lives, but I hope that this has given you something to think about. Maybe you're going to commit to something that you will do for yourself, and a reminder of taking care of yourself first so that we can be of service to the public that we are committed to and care so much about protecting the health of. And then one final note, like I said, remember that you can reach out to me I'm just leaving it wide open. If there's anything that you need the help or support with your organization, you individually, if you reach out, then I can point you in the right direction if we're not able to provide that support to you directly. And then I did talk about what we have coming up. I'm going to go into that in more detail very soon. And I'm going to be doing that probably from my personal page on LinkedIn. So if you're connected with me personally on LinkedIn, then you will be in the loop on that. So all of that's to come, but I hope this has been encouraging today. Until next time, I really hope that you all have a fantastic rest of your day. And I look forward to how we will come together and move forward and improve. And maybe a year from now, looking back over, all the accomplishments of this year, despite how rough it feels right now, there is hope. And I hope that you're starting to feel that, and it's soothing and comforting to you. All right. So I will see you soon. Bye for now. I do hope that this episode has been helpful to you in some way. We encourage you to share your thoughts. In the show notes, we've included a link to the live stream recording in case you'd like to add your comments and join that conversation. It's not too late to do so. The show notes page for this episode, which is episode 394, can be found at phecpodcast.com. Once you're there, just navigate to episode 394 to find its show notes and the link to that recording on LinkedIn. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.